Hi, welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, first of all, let me say happy holidays, happy New Year to you all. Well, the nursing homes in the state of Pennsylvania are having a very serious problem. Dr. Stuart Shapiro is here. We're going to talk about that, and then Penn State sexual abuse. We're going to look ahead at what might occur in the future. Pennsylvania politics and government in depth and in detail, and guess what? It all starts right now.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, welcome back to the program. Well, in the latter part of the show, we're going to do a little review of the Penn State sexual abuse scandal and sort of what lies ahead for both the university and for the folks who have been charged with some very serious crimes. But first, our pal, Dr. Stuart Shapiro, is in the house. He's the president and CEO from the Pennsylvania Healthcare Association. He's one of the experts we call in to talk about all things healthcare. Dr. Shapiro, Happy New Year to you.
Happy New Year to you and your viewers.
Thank you, thank you. All right, well, look, we got a bunch of things we want to get through. I want to talk about the nursing home problem. From what I can gather now, because of cuts to Medicare, more nursing home patients are not gaining access to nursing homes, but they're literally going to get extended treatment in hospitals, or reasonably extended treatment in hospitals, and that's creating a backlog in the system. Explain that to me.
Sure. First, quality of care in nursing homes is the best it's ever been. But the industry's facing a crisis. The crisis is because Medicare, which pays for about 20%, 15% of the people in nursing homes, has always provided enough of a revenue to the nursing homes so they could stay in business, because Medicaid, which is the state-funded program, which covers 2/3 of the people, has always dramatically underpaid. But what's happened over the last several years is there have been Medicare cuts at the federal level. 2009, big cuts. 2010, in order to pay for Obamacare, about $15 billion was taken out of nursing home Medicare reimbursement. Then, 2011, there was another major cut of reimbursement by almost 20%. So what happened is, you'll hear other sectors in our economy say they're having trouble surviving, they're beginning to destabilize, they're going to destabilize. What's happened is, nursing homes are now actually destabilizing. They're beginning to, because of these cuts in reimbursement and the problems of the budget at the state level, they're beginning to delay capital projects, they're laying off staff, and quality is the best it's ever been. And so what's happened is people are backing up in hospitals. People often come from hospitals to nursing homes.
Now they're staying in hospitals?
Longer.
Well, won't that be more costly?
Not only is it more costly for the system, but it's bad health care, because people go into the hospital to get better, but if they're staying there longer, it's not something to do with hospital care, but they get more infections, they lay around and they're not being rehabbed. It's not good to stay in hospitals.
Well, let me see if I understand this. When you go to a nursing home, Medicare pays for the first 90 days if you're eligible, is that right?
They pay most of the money for the first 20 days.
Oh, 20 days.
And then after that, they pay a decreasing amount, so that by the time the 90 days are there, they're not paying for anything. At the beginning, they pay 100%.
So basically, the coverage only runs a total of 90 days,
correct.
Is that correct? And then if they're eligible for Medicaid, then Medicaid would pick up the payment in nursing for the patients in nursing homes, right?
Right. And what's also going on in Washington right now is Medicare is even looking to reduce the amount of money they pay in those first 20 days by fiddling with a bunch of the formulas. So it's a real problem of getting Medicare to even pay its fair share, which they paid before.
I got it. All right, we're going to run to a break. When we come back, I want to shift gears a little bit and talk about how the Medicare reimbursement, the doctors can have sort of a ping-pong effect on the healthcare system, but also potentially on nursing homes. All right, we're talking about about a very important healthcare subject with Dr. Stuart Shapiro. We'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania Cyber Charter School, bringing educational innovation and freedom to the children of Pennsylvania. This broadcast of Pennsylvania Newsmakers is presented by ReconnectPA.org, supporting a comprehensive transportation funding solution, and by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, welcome back to the program with Dr. Stuart Shapiro. We're talking about all things healthcare. As we tape this, I'm not quite sure what's going to happen to the 27% cut to doctors for the reimbursements for treating Medicare patients. Dr. Shapiro, we know, for example, that some doctors are now saying, I'm not treating Medicare patients anyway because we're not getting enough money, they're not covering our costs. What's the long-term implications in healthcare reform for these cuts to reimbursements? Let's just talk about doctors first.
Well, first, what you refer to as the doc fix has got to be fixed. This started in 1997 with a silly formula. So doctors, and they've been fiddling with this every year, they know they have it wrong, so they have to fix the formula. And every year they have to figure out how they're going to pay for fixing the formula. Unfortunately, this year, in order to fix the formula, they want to reduce Medicare reimbursements again to nursing homes. So this has, just as we talked about in the first segment, a double whammy on nursing homes. Now, this whole problem of Medicare is compounded here in Pennsylvania by the state's budget. And I think Tom Corbett got it right last year. When he presented his budget, he said, we have to deal with the must-haves, not the nice-to-haves.
Right.
Just before Christmas, the Budget Secretary, Charles Zogby, said quite articulately that we have another $500 million hole in the budget.
Right.
So the real problem is how is he going to address that without balancing it on the backs of the old people?
Right.
And the governor, I know, cares deeply about the elderly, as does the legislature. But they have to focus, at least in my humble opinion, on the must-haves, not the nice-to-haves.
Yeah.
And that's really the goal. And the must-haves in Pennsylvania are the frail elderly, those that are the sickest, those that are in our nursing homes, those that have no place else to go, and those who deserve quality care.
You know, there is a potential ripple effect going on here that I think we ought to be concerned about. 50% of the doctors in our state are eligible, and say they will, eligible to retire, meaning, you know, they're going to reach the age within 10 years. We already have these doctor shortages. It looks like in virtually every proposal you see out of Congress, including the $1.2 trillion deficit reduction that automatically will take place in 2013 if Congress doesn't fix it, they're cutting healthcare reimbursements as part of that again. So it looks like we're looking at more cuts to the providers that perform important services to healthcare patients.
No question about it, and it's a discouraging profession today. But again, you talk about that cut in Medicare. Again, the super committee's failure means that nursing homes throughout this country
will lose money. Are
going to lose another 2% reimbursement. Yeah. And the bottom line is that the industry, high quality, it's taken years to get to the good quality it is today, is being destabilized.
The next time you come on, I want to get to tort reform. We're probably not going to have enough time to do it. We'll have time the next time you're on. It's an important subject, legal liability reform. But before I let you go, I want to ask a question about this doctor shortage, because maybe because I'm worried that I won't have access to a doctor. But here's the point. Does this worry you that we don't have, that we're missing? I mean, you're the expert. We're losing specialists. Rural Pennsylvania, which doesn't get a lot how should I put it? It's not a lot of ink, not a lot of press on doctors that, you know, if you live in a rural part of our state, we have a big state.
Oh, there is a tremendous shortage of physicians, especially in rural areas in Pennsylvania. But it's interesting. The biggest shortage is going to happen as the baby boomers age. We have
good point.
10,000 people turning 65 every day this year.
Right.
And will continue for the next 20 years to the 77 million baby boomers retire. There is a terrible inadequacy of all kinds of care providers trained to care for the elderly.
Yep.
We don't have it.
Yep.
You can't find in so many communities someone trained in geriatric medicine. There aren't enough nurses.
Mm-hmm.
There aren't enough physician assistants. There aren't enough doctors. There is a real problem out there,
Mm-hmm.
lying there, and no one's addressing it, of who's going to care for the elderly.
Yeah, I mean, and overall, we have great, I mean, I think Pennsylvania, we're very fortunate. We have great medical facilities. We have, you know, a good cadre of doctors, but it's the shortage and the access to doctors. Once we have so many people, elderly, who need medical services, I think we're going to have, you talked about a quality problem earlier. I think we're also going to have an access problem.
Oh, there's no question. And we're going to have an access to quality care in the future.
Point. All right, there you have it, our health care update to start the year. Okay, the Penn State sexual abuse case. We're going to do a little review on what might happen in the months ahead with two of the state's leading journalists. We'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education. 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania. And by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Hi, welcome back to the program. Well, joining me, as often is the case, two of the state's leading journalists, Tony Romeo with KYW-KDKA Radio and Laura Olson with the Pittsburgh Post-Gazette. We're going to do a quick wrap-up here on the Penn State sexual abuse case. We'll bring you up to date, and then we'll look ahead. Tony, let me start with you. Jerry Sandusky charged with 52 counts of various forms of sexual abuse. I guess I'll use that as an overall. We have two Penn State administrators also charged with perjury and some other counts that deal relatedly. What was the big takeaway from the year, in addition to the obvious scandal, that you find in these charges?
Well, it certainly has brought new awareness to the issue. In fact, we are now seeing a scandal breaking in Philadelphia with a Hall of Fame baseball sports writer,
right.
And the people who are accusing him have cited the Sandusky case as one of the reasons that have prompted them to come forward.
All right, Laura, let's go to another aspect of this. All three of these people, the two Penn State administrators and the football coach, Jerry Sandusky, are bound over now for trial, right?
Sure.
Both of you were at both at Penn State and at the preliminary hearing, I guess, where they, in a sense, decided these charges would be formally adopted. Do I got that right, factually? What in your coverage of this, it all seemed to hinge on the testimony of McQuarrie, Coach McQuarrie, who saw Jerry Sandusky in the shower with this 10-year-old. Give us and they looked at it, there were some differences in the way he described all this. Start an explanation of that for our
In order
viewers.
for the prosecutors to prove that the two Penn State administrators perjured themselves and lied to the grand jury, you have to go back to what Mike McQuarrie supposedly told head coach Joe Paterno about what he saw in that shower locker room in 2002, and then what Coach Paterno and Mike McQuarrie later told those administrators. And that's where we've seen in the limited testimony that's come out so far, the discrepancies starting to appear. There's a couple of versions of what Mike McQuarrie supposedly told the coach, told the administrators, and told others.
How graphic he was about what he saw.
Exactly, saying that, maybe he wasn't as graphic in order to alert the coach and alert the administrators to saying, yes, this is something that is of a high concern.
Yeah, Tony, you've covered a lot of big stories in this state in your career, and I won't ask you where this stands in terms of the...
Right up at the top.
Right up at the top. I'm sure you would have said that. But you've also, what sense of this about how Penn State has reacted to this and how they've handled this. There's been a lot written about it, about whether they were quick enough. In your sense, how has that all developed over the course of the last several months?
Well, I think Penn State's been universally panned for their response, beginning from the beginning with the statement that was put out by then President Graham Spanier on the day the story broke, where he expressed his unconditional support, as I recall, for the 2 administrators who were charged with perjury.
And then resigned.
Well, and then resigned a couple of days later.
Under pressure, obviously.
Right. And of course, this is what the focus is of the charges against the 2 administrators are, that essentially that the allegation, the charge specifically is perjury, but underneath that is the allegation that they simply essentially looked the other way.
Yeah. I mean, Laura, I think that's one of the big questions that remains to be answered is, you know, how much did Penn State officials know, how quickly they were moving on it. The NCAA is looking into it. I mean, the NCAA, quite candidly, not known to move too quickly on these things. And the legislature has reacted by strengthening sexual abuse reporting. Am I right about that?
The legislature is putting together their own panel as well to look at the state's reporting laws. That's going to be forming in January when the General Assembly returns. There's going to be lawmakers, some agency officials, advocates for victims, those types of folks who are going to go back and look at the state's laws, see where there may be problems, and see what those folks need to change, as well as internal investigations at Penn State. I mean, everyone on every level seems to be trying to look at this and figure out where things went wrong.
All right, we're going to run to a break. When we come back, Tony, I want to ask you about the role of Governor Corbett in all of this. As you know, he was on the Penn State board. You know, he was Attorney General when this investigation began. See where his role in this and what the state might what role the state might play moving ahead. We'll be back with more of the Penn State sexual abuse scandal following these words.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care.
Hi, welcome back to the program. We're doing a quick review of the Penn State sexual abuse scandal. We're bringing you up to date on the highlights of it, and then we're looking ahead with Tony Romeo and Laura Olson. Both have been covering this, all aspects of this trial since the beginning. All right, Tony, before we look ahead a little bit and speculate about what might occur, much of it seems to hinge on, not just for Sandusky and the 52 counts, but with the Penn State officials about what they knew and when they knew it, meaning what Sandusky may or may not have been up to, with the testimony of this coach, McQuarrie, who observed Sandusky in this act with his 10-year-old in a shower in the Penn State football locker room. Do I got that all right so far? Yeah. And how important do you think his testimony ultimately is? I know there's, a bunch of other people, 10 or 12, who are actually going to testify that they were sexually abused by Sandusky. What's McQuarrie's
Well, his testimony is very important because it's been said a number of times, it's very unusual to have an eyewitness to sexual abuse of a child. First of all, it's very important to the Sandusky case, but it's entirely critical to the case against the 2 Penn State administrators, since that really is what that all revolves around. I mean, in the preliminary hearing, McQuarrie testified that he was certain that there was something of an extreme sexual nature going on in the shower there, even though he didn't see certain things, and we won't go there.
Right.
And then he went to Joe Paterno and told him that he made it clear to him, he said on the stand, he made it clear to Joe Paterno that he saw something very sexual taking place, but admitted he did not use certain, he, out of respect for Paterno, did not use certain graphic terms. And then subsequently testified that when he and Paterno met with the 2 Penn State administrators, that he again communicated to them that he saw something very, very serious.
Now, Laura, this is the linchpin to the charges against the administrators for perjury. I know we're going back over this, but I want this to be clear for our viewers. if his testimony was significant in having them bound over for a trial. Go ahead, finish my thought.
At that preliminary hearing, his word choice was what we kept hearing over and over again. Did you use such and such a word? Did you use such and such a word? Just having the defense attorneys try and portray what he did or did not say in as specific terms as possible. Because when we got to Coach Paterno's testimony, which they read what he said to the grand jury, he said that Mr. McQuarrie had been visibly upset, and so he didn't press him harder.
I get it. But
one of his following statements was he didn't call anyone immediately on that Saturday morning because he didn't want to upset anyone's weekend. And so that sets up kind of this contrast of how strong was the word choice that McQuarrie used, and did he get his point across?
Now I want to come back. Now I want to go to Governor Corbett. He was AG, Attorney General, when this investigation began. His office called for this grand jury 2 years. There, in the past, now we'll look into the future in a minute, some concern about the length of time. Now, you've covered a lot of grand juries. They take time. I mean, I'm not defending the governor. I mean, look at Bonusgate. Look at all of the... What's your sense about how the earlier stages of this investigation went?
Well, I mean, you have to go back all the way to 1998 when there was an allegation that went unprosecuted. And so to the extent that Governor Corbett, as Attorney General, actually initiated an investigation that brought charges, I don't know if he gets credit for that. And I also think that, you know, I'll turn the question around, and that is I don't know a lot about investigations and how they proceed. And while it's a valid question, I think, to ask about why charges weren't brought sooner, I have to say that the people who are making accusations in that regard are doing so without understanding necessarily, certainly, the facts of how this investigation proceeded.
You're shaking your head.
Sure.
Yeah.
The one thing that we've heard time and time again from the governor about all of the prosecutions, as Tony said, is that they take time, and that you have to make sure that you have all those pieces in line, because they made the argument that if one of the cases were to fall, it makes it harder to prosecute the rest.
You get the last word. None of these trials are I mean, these trials are going to take place sometime next year. Does anyone expect this not to be a lengthy process? Lengthy process?
Absolutely.
Lengthy process?
Yeah, and it may not even come to trial next year.
All right. Thanks for a great update. I'm sure you'll continue to cover it for your respective news organizations. And thanks for watching Pennsylvania Newsmakers, and you stay well.